The findings surrounding the use of pelvic osteotomy in children with developmental hip dysplasia raise deeply troubling concerns, not just for families directly affected, but for public confidence in paediatric care in this country. We're talking about children, vulnerable young patients whose parents entrusted the health system to do the right by them. Yet serious questions now hang over whether some of these children underwent invasive surgery unnecessary or without proper clinical justification. This is a frightening prospect, and it demands a full transparency, accountability and urgency in response. I welcome the commissioning of an independent external medical audit, but I believe that we have to go outside of the country, not in Northern Ireland, outside of the country, to get true independence for a proper audit. But let me be very clear. Families deserve to know the full truth, not sanitized summaries or indeed bureaucratic brush-offs. The audit must be thorough, independent, and in the true sense, and patients-focused. Anything less would be an insult to those children who may now be living with lifelong consequences. Furthermore, lack of clear national guidelines or oversight around indicators for complex orthopaedic interventions like pelvic osteotomy is unacceptable. This is not just a clinical matter. It is a systemic governance failure that must be addressed by the HSE, the Department of Health and indeed this House. We need to listen to families, protect whistleblowers and support them even, and ensure that no child is ever again subjected to any procedure that may not be necessary. And we have to have changes. No point coming in here like we had an apology this evening and a very profound one from the Minister for Justice. Look, this is clearly unacceptable. It's scary. My late brother was a paediatrician of some renown, and I can't imagine what he'd think at what's happening today. It's just not acceptable. And GHI came from the HSE, giving it back to the HSE now. The fundamental failures there. We need true independence. Thank you.